Hey guys, this is Dr. Herb. Today we look at the composition of the CO2 absorbers in the rebreathing system. So first, to begin with, we look at the soda lime. So we look at soda lime. What happens in case of soda lime? So the components, it includes the calcium hydroxide, CaOH. This will be about 80%. Then comes the NaOH, and this will be about 3%. Then is the potassium hydroxide, that is 2%. Then comes the silica, that is about 0.2%. Then is the moisture. So moisture, if you see, it is about 14 to 19%. So this is all about the soda lime. So here we need to know that what happens in case of the granulation size. So what happens in case of granulation size? So granule size. This is a 4 to 8 mesh. So it absorbs up to 23 liters. So it absorbs 23 liters. This is of the CO2 as well as the 100 grams. And with trilene. So this is with trilene. So along with trilene, the soda lime, it forms neurotoxin. So along with trilene, the soda lime, it forms the neurotoxin. It forms a neurotoxin as a dichloroacetylene. So with trilene, the soda lime forms a neurotoxin dichloroacetylene and a pulmonary irritant, phosgene gas, and a pulmonary irritant, and this is nothing but it is known as a phosgene gas, and hence it is contraindicated. Next, the sevoflurane, it reacts with the soda lime. So the sevoflurane, it reacts with the soda lime and produces a compound A. Then when you look at the method of hardness, so method of hardness in case of the silica, there is absorb, that is, there is CaOH, calcium hydroxide, calcium chloride, as well as the calcium sulfate. So it causes less degradation of volatile anesthetics. So it causes less degradation of volatile anesthetics, and example here is that it includes sevoflurane. To compound A or desflurane to the carbon monoxide, or desflurane, this is to the carbon monoxide. Next we move on to the Brera lime. So here it includes the calcium hydroxide about 80%, and then the Kaba, that is next is the barium hydroxide. This will be about 20%. Then the KOH is very minute, that is less than 1%. So what does this do? It absorbs up to 18 liters. So it absorbs 9 to 18 liters. And this is of the CO2. It is of the carbon dioxide as well as the per 100 gram. So the desflurane can be broken down to the CO. So desflurane, it can be broken down to the carbon monoxide. This is by a dry barium hydroxide lime. This is by dry barium hydroxide lime. So the method of hardness is nothing but, so what is the method of hardness? The method of hardness is nothing but the water of crystallization. Nothing but the water of crystallization. So this was all about the composition of the carbon dioxide absorbers in the rebreathing system. To learn and grow daily like this, please do subscribe.